as SDG Paramedic Services awaits an increase in calls due to the COVID-19 pandemic. I'm joined now by the Chief, Bill Lister. Welcome, Chief.
Thank you so much.
All right, so let's talk about, first of all, you're definitely expecting an increase in calls.
That's correct. The COVID virus is in the community. It's still contact spread, which means you have to be within 2 meters of somebody who has it. But the anticipation is the flattening of the curve is about at its point where it's going to be more widespread across the community, which means more calls for ambulance services.
All right, so there's specific reasons that people should be calling 911 and specific reasons that they should reach out to other resources. So can you clarify that for me?
Yes. So with the increasing in call volume that we anticipate through the signs and symptoms of COVID, we'd ask that anybody who's having an emergency, which would be something like you think you're having a heart attack or a stroke, or you've been unconscious, or you have unexplained shortness of breath, you should call 911. Don't hesitate to call 911 for any emergency, but what we're asking is the minor flu-like symptoms should not be a reason to call 911.
All right. Now, the paramedics are partnering with the health unit for some home testing. Can you tell me a little bit about that and how people can access that?
Certainly. So the Cornwall paramedics and the Cornwall SDG paramedics, excuse me, are working with the Eastern Ontario Health Unit in order to do swabbing, which is the test for COVID infections in the community. The way that works is you would have to call the health unit. They send out a requisition, and a paramedic would arrive at your door, and they would do the test and process it, and the health unit would then follow up with any kind of healthcare-related needs following the test. We've been doing that since about March the 12th, continues straight through Monday through Friday.
Excellent. And just to reiterate, that is something that goes through the health unit, not to call 911 just to get a swab test, correct?
Exactly. Yes, the health unit has numbers on their website. It's also on the City of Cornwall website. So the Eastern Ontario Health Unit, 1-800-267-7120. They also have expanded telehealth help, which can provide assistance on what you should do if you feel you have COVID.
Excellent. So let's talk a little bit about what paramedics are doing and what paramedic services are doing in order to prepare for this increase in volume that's being expected. I believe you're hiring some new paramedics as well. And what else?
That's correct. So the anticipated call volume increase is going to require more ambulances on the road. We have a fairly consistent pattern of about 50 calls per day, and we staff appropriately so that our response times reflect about 50 calls a day. We're anticipating that call volume will increase to upwards of 60 and potentially even higher. So we're hiring new staff on as quickly as we can. We're working with the colleges and our Human Resources Department to bring on new paramedics as quickly as we can so that we can add ambulances to the road. We're also changing some of our protocols so that we can refer people to the the Community Paramedic Program, instead of transporting them to the hospital. So many of the flu-like conditions of the paramedics that the paramedics see when they go on the call don't require hospital intervention. They can be treated with symptom relief drugs and or just some advice, and they can do that from the home. There's no need to take these people to the hospital, and we're working with that to relieve the pressure on the ambulance system and also relieve the pressure in the emergency departments.
On that note, Bill, I'd like to thank you once again for joining me and updating our viewers, and thank you to you and everyone at Paramedic Services for all the preparations you're doing and all the hard work that you are doing and will be doing to keep Cornwall and area safe.